Imagine the government policies were directly linked to why food in poverty stricken areas contribute to major health disparities and even premature deaths among low income individuals. Sadly, this isn't a hypothetical, it's our reality. The government should provide increased funding to low income areas to create access to healthier food options and combat food insecurity and reduce preventable health issues. Many of us live near or have seen communities where people rely on convenience stores for their groceries simply because there are no full service supermarkets nearby. The lack of access affects not only individuals, but the health and economic vitality of the entire neighborhoods. Today, I'll discuss the problem of food deserts, explain what causes them, and share government-based solutions that can ensure low-income communities have better access to healthier food options. Let's start identifying the problem. According to the U.S. Department of Agriculture, more than 19 million Americans live in areas with limited access to affordable food and nutritious food. In many of these areas, families rely on fast food restaurants, convenience stores simply because they're the only nearby options. The reliance contributes to higher rates of obesity, heart disease, and diabetes. The Centers for Disease Control and Prevention reports that individuals living in food deserts have a 30% higher risk of obesity and diabetes that those have access to grocery stores offering healthy food options. Now that we've identified the problem, let's look at what's causing these food deserts. One major cause is economics. Grocery stores chains in low-income areas are often face lower profit margins and higher operating costs, discouraging them from setting up shops in these communities. Another issue is transportation. Many residents lack reliable access to cars or public transit, making it difficult to travel to stores and sell fresh produce and other healthy items. Finally, decades of disinvestment. Limited public funding and poor urban planning have left these areas without infrastructure needed for full-service grocery stores. Now that we understand what's behind the problem, let's talk about how we can fix it. The government has the power to change this. First, the federal and state governments can offer tax incentives and grants to grocery stores that choose to open low-income communities. Second, expanding programs like Healthy Food Financing Initiative can provide financial support for local markets, community gardens, and urban farming projects, helping communities grow and sell their own fresh foods. Lastly, public education campaigns focus on nutrition and affordable cooking, and affordable cooking can help families make healthier choices and even with limited budgets. Let's wrap this up. The government should help fund low-income areas to increase access to higher food options, reduce health disparities, and improve overall quality of life. Today, I discussed the problem of food deserts, the causes behind them, and government-led solutions that can make a real difference. I challenge everyone here to support community gardens, local farmers market, policies that invest in low-income neighborhoods, because healthy food should be a right, not a privilege.